So women, they say that 80% of women during that phase of the life will experience either physical or psychological problems, or probably both. And a lot of the problems are insidious and they kind of creep up. So a lot of women don't really, truly appreciate the impact that it has on their quality of life. And I think historically people often thought the menopause as an older lady's problem, but actually it's not. And we know that if you think the average life expectancy for a woman in the UK is about 84 years, the majority of your life, if not half or a third, you're in this kind of post-menopausal or perimenopausal phase, so it's a huge part of your life. So to have to live with horrible side effects or symptoms of it is really not nice, not necessary, and the more that we know about the menopause and its treatments, the more we can do to really improve and help people's quality of life. And a lot of women in that age, you've got, school-aged children, demanding jobs, or you're caring for elderly relatives. And it's really paramount that you're able to do that every day. And so I think despite all of the symptoms that women are plagued with, because they often do kind of creep up on you, a lot of people are unaware of the things that they can do to help themselves, but also unaware of the huge impact that healthy lifestyle, so diet and exercise and things to improve your mental health, can also massively help symptoms of the menopause, and we'll talk about that. So, and also regrettably, a lot of us are misinformed. So HRT came about in about the 1940s, and then in the 1960s it became readily available. But overnight, in the 90s, kind of early 2000s, two incorrect studies that hadn't been appropriately and reliably evaluated the data said suddenly there was a huge concern with breast cancer. And overnight, these poor women were told to just stop the HRT by health professionals who felt like they were given the correct data, but obviously hadn't been, the kind of the papers weren't properly founded. And so women were thrust back into horrible symptoms of the menopause. And it wasn't until about, I think, 2012 when a Danish study was released, actually misfounding a lot of the scares that had been released in the early 2000s. And from that now, with every year, we're finding more and more about what actually happens in the menopause and the benefits, the long-term benefits that HRT can give you. So I suppose the main thing to take home is that we can do something about all symptoms of menopause. Women shouldn't have to struggle. And but when you take on the idea of taking HRT, it has to be clearly and carefully discussed with a health professional and weigh up the health implications and the benefits, but also your personal preferences. So there are lots of different formulations of HRT that come in at loads of different kind of arrays, tablets, moisturisers, gels, pessaries, vaginal things, loads of things. I think you really need to know what your key symptoms are, what you want to treat, and then discuss that sensibly with a health professional, and every doctor should be willing to do that. But there are some features that we have to take on board, and that is a woman's weight, so BMI, past medical history, as I'm sure we will have heard from you earlier. Things like blood clots and strokes often implicate or change what HRT may be available to you. If you've had breast cancer or you've got active breast cancer or wound cancer, that also changes the outcome. And other than that, you've got pretty much free reign. Most women are free and able to be able to take HRT. So I think looking at the questions then, I'll try and address the questions that people submitted. The main one, I think, and the most common one was, what are the risks about HRT, particularly what are the risks with breast cancer, but I'll try and talk about everything. So if we took breast cancer, if we take 1,000 women of the perimenopausal age, so say from ages 50 to 59, in the next 5 years in the general population, 23 of them will get breast cancer of that 1,000, and that is the statistic. Now, if we give all of those 1,000 women combined HRT, so a bit of estrogen and a bit of progesterone, an extra 4 women out of that 1,000 will get breast cancer. So it's not massive, but I think that's definitely your perception of risk. Some women might think 4, that's a lot, I could be 1 out of 4. And other women will be like, well, actually, there's a lot of women in 1,000, 4 is pretty minimal. Actually, if all of those 1,000 drink 1 glass of wine a night, an extra 5 will get breast cancer. So you can freely go into the supermarket and buy a bottle of wine and need no counselling at all, and yet you've got to be counselled until the cows come home for HRT. And the other thing, I think, to kind of put it into perspective, actually, if all of that 1,000 weight, so if they all had a BMI of over 30, an extra, what's the statistic? 24 women will get breast cancer. So actually I think when you know that and you can realise the true impact of both weight and alcohol, actually HRT in relation to that is much smaller risk. But also I think it's your personal history. You know, if women have got a family history where a lot of women in their family have got breast cancer or had breast cancer, then they understandably are going to be much more concerned. However, so yes, there is the risk of breast cancer. It is there and we can't deny it, although it's thought to be smaller than what we thought it was originally. There is also thought to be slight increased risk of womb cancer and ovarian cancer, but they're tiny, so much so I don't have the statistics for you. And again, we'll also have a huge link to lifestyle choices. I think if we look at the benefits of HRT, and the more we know about it, the more women are on it, the more we know there are huge benefits. If it started before 60, so in the thrusts of the perimenopause where women are really symptomatic, we know that it massively reduces your cardiovascular risk factors. So by that we mean the thawing of vessels in your body with fats that ultimately lead to heart attacks and strokes. And we know that is looking like it is very beneficial. So in a woman who potentially has got more heart attacks than breast cancer, probably is in your interest to take HRT than not to. But it is the key thing that it's taking it below 60 it improves that risk. Likewise, it is a licensed treatment to stop thinning of the bones. So we know that after the menopause or during the time of menopause, when a woman's estrogen levels drop, your bone kind of density becomes much more weak and you're much more likely to develop thinner bones as you get older, and if you fall, much more likely to get fractures such as hip fractures and wrist fractures, and HRT will stop that progression. So there's definitely benefits for it, but there are risks. We do think there is a link between giving anybody hormones, so whether that's when they're pregnant, contraception, HRT, of increasing the risk of blood clots and strokes. So that is also a risk. But actually, the more we know is you've probably heard of many women taking HRT through gels or patches, anything through the skin rather than tablets. Actually, that risk is thought not to be there. So the risk of blood clots and strokes massively reduces if you have a topical formulation. So I think really, and I know it's bombarding you with information, but I think the key thing is that there is risks and there are benefits. Some women come to the doctor and they say, actually, I found that it's beneficial for heart disease, so I want to take it because everybody in my family's had a heart attack in the 60s. I don't necessarily think that's the right reason to start HRT. I think you've got to remember that HRT should be started purely for symptom control, not for its benefits or its risks, because they're all relative and no one can predict that in the future. You've got to take it because there is a symptom such as horrible night sweats, day sweats, joint pain, brain fog, fatigue, struggling to sleep, increased anxiety, worsening mood, all of those horrible things that are associated with hormonal changes. They're the things that you should be taking it for. So if you are one of the 20% that haven't got any menopausal symptoms, I wouldn't advise taking HRT purely because of its health benefits. I would take it to overcome a symptom. Let me just make sure I've covered everything. There is early evidence I've seen in the news today that HRT can prevent Alzheimer's dementia. I don't know whether there was an article in BBC News this morning about it. It's not truly founded, so they've not done proper control trials, but what they do know in women, certain of us will carry a gene that increases our risk of Alzheimer's, and that's just luck of the draw. What we do know is that when we give women HRT, their brain tissue tends to be healthier, and it may prevent the onset of that early onset Alzheimer's dementia, and they're needing to do more trials to properly found that, but that it is looking promising. And we also think there is early evidence to say that it prevents against type 2 diabetes and colorectal cancer. So I think when you think about the risks, there is the increased risk of breast cancer, womb cancer, ovarian cancer, and potentially, depending on how you take it, strokes and blood clots. There is also a lot of benefits, and I think only you can make that personal decision in discussion with your doctor whether it's beneficial for you or not. Is that all right? Because I know it's a lot of information. Is there anything about risk that either have not been clear or you want to ask about? Your blood pressure has to be controlled to start in HRT, purely because we think there's this increased risk of stroke. And if you've got uncontrolled blood pressure, you add in a hormone, you're potentially increasing your risk further. There is no true link between HRT and increasing blood pressure. In some studies, it shows that actually it may reduce it slightly, purely because of also it may improve your mental health, it may improve your anxiety, it may improve generally your quality of life, which thus can improve your blood pressure. But it's so hard to prove cause and effect in a lot of studies. So as long as your blood pressure is controlled, you can take HRT, but there's no correlation between HRT and worsening blood pressure control. Again, there's no studies to say that, but what we know is that after the menopause, clogging up of the arteries exponentially increases because you've got less estrogen. So your kind of physiology shifts a little bit like a man, because men clog their arteries much quicker, they haven't got as much estrogen. So we suspect that if you're taking HRT, that kind of clogging up of the arteries slows down. It doesn't happen at the rate of knots that it does in some women after the menopause. And vascular dementia is just that, it's just clogging up the arteries in the brain, and therefore we suspect it may improve it, but again, there's been no studies to say definitely. What we do know is if you've left a long gap between stopping your periods and then thinking about HRT, so about 10 years, or you're over 60 and you suddenly start HRT, you run the risk of disrupting any of those plaques or that clogging up of the arteries that's already there. And therefore, on starting HRT, you may increase your risk of something like a stroke or a clot. But in terms of starting it young, or at the onset or in the thrust of the menopausal symptoms, it's probably beneficial for vascular dementia in the long run. The risk of breast cancer does not increase if you take HRT before the age of 50, because effectively you're only replacing the hormones that we'd expect to be there in most women by that age anyway. So most women have gone through the menopause by the age of 55. Some women are a bit older, some women are younger. But at the age of 50, would it still expect a level of circulating estrogen? In terms of breast cancer, taking HRT doesn't increase death from breast cancer at all. So even though the numbers are higher, you're less likely, if you do get breast cancer, to die. You're the same to die from it, risk, than if you would do generally. And we know that it doesn't increase your chances of developing breast cancer, but if there's cells there that are to turn into breast cancer, they more quickly become, because a lot of them are fed by the hormone, the estrogen. So before the age of 50, you're less likely to have any cancerous cells there, and we're only replacing the estrogen that you should probably have in your body at that point anyway, or that we know that's safe. So up until the age of 50, there's no increased risk of breast cancer. Taking it after the age of 50, it increases, but it increases with the duration of use rather than the dose. So if you say, oh, actually, I'm going to run the risk and I want to take it for an extra 2 years because my quality of life is better with it, kind of the shorter amount of time that you take it, the safer really. So the next thing that people asked me about was bioidentical hormones. So you may have heard, thanks to Davina, and she's done a great job in pulling it to people's awareness. Absolutely, that's what needed to happen. But I think a lot of the things that have been presented in the press are slightly incorrect. So bioidentical hormones is almost like a marketing term by a lot of private providers. It's not actually medically founded. So basically, there are so many different, I don't know how to put it in a kind of chemical versions of estrogen in your body. Some active, some inactive, some have an extra arm chemically on them, and they all do slightly different things. When we give you HRT, it is obviously a chemically formed version of those hormones, and a lot of them put together because we understand in science that your body's got them all in. And they've gone through rigorous testing to know that actually we're giving you the right amount. It's controlled. We know that under a certain threshold, it's safe, and we know the correct amount of progesterone to give you, because we have to give you both to keep you safe, because it's the estrogen that can cause the risk of wound cancer, and actually if we give the progesterone, it kind of combats that and gives you the balance. So private providers are saying, menopausal women we'll do a hormone profiling test and see which ones you're low on, and then we'll give you more of that or whatever, and they're totally bioidentical to what your body is. But actually, it's not known whether you need any individual separate one, and some of them compete for the same receptor in your body, so actually that it's not known that it's safe. They don't often give you the other safe hormone to kind of balance them out. And so I would really strongly advise women from going to private providers that haven't been through the MRHA and done the correct drug testing to know that you're actually getting something that is safe. I think medically we probably need to market the hormones that we prescribe and say that HRT is body identical. It's not bioidentical because it's not all the individual ones, but it is identical to your body. It's just compounded, so they're often put together, so you have all the hormones that women have. So yes, some may have a lower amount of that estrogen than that estrogen, but actually in general it's the lack of estrogen per se that's giving you the symptoms, and that's what HRT is replacing. So you are much safer to get prescribed HRT that is bioidentical than paying a private provider to get something that's bioidentical, because as of yet that safety has not been proven. The other question that came up quite a lot was, how do we know? So how do you know if you're menopausal? And that's a really good question. So basically, if you are 45 and over, it is a purely clinical diagnosis. You don't need a blood test to tell, you don't need anything else. If you have got symptoms of periods becoming more spaced out, lighter, brain fog, or joint pain, stopping sleeping, increased anxiety, agitation, all of that is probably related to some degree of hormonal change, and it's safe to say that you are in that perimenopausal stage of your life. If you're younger than that, then we have to do blood tests, because we wouldn't expect you to have dropped your estrogen by sufficient enough before the age of 45 to cause those symptoms. So then we do 2 blood tests. And saying that, if you are over 45, but you haven't really got symptoms that you could say, I'm reading a menopause book and that is just me, but actually, and your periods, you're on contraception or you've got a coiling, or for whatever reason you don't get periods, so it's even harder to judge, then we can do blood tests to check. And I suppose the doctor and me as well, I think you always need to consider it to make sure you're not missing anything else, and I think it's always worth to make sure you're not deficient in iron or vitamin B12, or something that can just cause you to feel pretty crap most of the time that is easily fixed. So it's just always worth just having that conversation with your doctor and questioning it. But I think most women will read just a paragraph of the menopause over the age of 45 and say pretty much I'm ticking all of them, and you can say then without a doubt that you probably are in the throes of it. And actually you don't need to be missing periods to try on HRT. So if you're over 45, you've got all the symptoms but actually still getting a pretty regular period, you can try HRT, why not? And see whether it helps. And I suppose if it improves all your symptoms, then there clinches the diagnosis that it was probably hormonal. So it's not a one shoe fits all, and it's not, you can't just say, yeah, that's definitely it, try that, it's going to fix your problems. Every woman is different, and it's a bit like if you ever took the contraceptive pill, one thing will suit one woman and not another. So it's very much trial and error. And I suppose it's also worthwhile in knowing that there are lots of different, so every HRT, even just tablets, there are loads of different types of synthetic hormones in them. So if you take one and you think, oh my goodness, this is awful, just cried of this, it's not me. Well, it doesn't mean to say that you're going to be like that on all HRT. You can swap and change. Or if you get breast pain with one, try one that's a bit more breast friendly. So it's really worth logging what your symptoms are and speaking to somebody. And that's why I suppose another benefit is, and I'll just get this out there, the gold standard form of HRT is to have a Mirena coil and topical estrogen. So Mirena coil gives you progesterone, and that sits in your womb. And topical estrogen, obviously, is just like a gel or a patch or a spray. And that the reason why that is the safest, other than compared to any other HRT, is because the progesterone stays in your womb. Yes, there's some systemic absorption, but we suspect less than if you were to take a tablet. And it's the progesterone that increases the risk of breast cancer. So potentially it's less, but it's not been proven. Less systemic progesterone, so less chances of feeling bloated, moody, spotty, weight gain, all that horrible thing. It's also the best way of maintaining the womb lining to reduce the risk of womb cancer, so it's safest form of any way of protecting your womb. In fact, women that don't take HRT in the general population that have a Mirena coiling are less likely to get womb cancer than women that don't. And your topical HRT is safer for blood clots and strokes. So actually, if I was going to choose a way, that's the way I choose, and that's the way I always advise women. But I totally get that Mirena coils are not for everyone, and some people, rightly so, just don't want it. I would say 12 weeks to give it a good go, because you might find that the horrible breast pain that you get at the start actually settles by the end of 12 weeks and it's in your system and you're not plagued by those symptoms that may resolve. So I generally start women on it and don't book that 12-week follow-up and leave it to them, because I say you might find that you get to 11 weeks and you've not even noticed because you feel so great, and at which point we'll put it on your repeats. But you might find very quickly that it definitely is not for you and are not prepared to continue for that 12 weeks, in which case you need to speak to me sooner. But I would say to give it a fair go, probably 12 weeks. It's probably actually longer than that, because if you get any bleeding abnormalities, that can take up to 6 months to settle, but I think you'll know yourself around 12 weeks whether it's the right thing for you or not. So testosterone, again, it's had a lot of media coverage as kind of the hormone that women need to increase their libido and their ability to have an orgasm and to maintain that sexual relationship. We know that actually you need to have adequate HRT, so you need to be adequately estrogenised, because some women will get an improvement in the libido and the sexual desire with the HRT alone. And if it doesn't improve with that, it's then that testosterone should be considered. So it certainly shouldn't be considered as an alternative to HRT. You need to be adequately estrogenised. Unfortunately, in the UK, testosterone does not have a medical licence to be prescribed for this purpose. So because of that, and I suppose rightly so, a lot of medical professionals are a bit wary because they're not backed up. If anything went wrong, there's no legislation to say, well, there was any safety around that, it's licensed, it's kind of like you take responsibility because you prescribed it, but it's not got any license behind it. And I think also because of that, we know that it's safe because people are prescribed it when, men are prescribed it when they've got primary testicular failure and things like that. We know it's been around, but we don't know the safety in women. We know that given at incorrect doses, it can lead to male pattern hair growth, so hair on the back of your hands, down your face. It can lead to male pattern balding, so recessive hairlines or balding at the back, muscle changes, clitoris enlargement, all things that actually we have no way of regulating or knowing because there's just not that evidence and safety behind it. So the British Menopause Society have released some vague guidance to say it probably should be in this region if you test a blood test, and if it's above that it needs to be stopped, but we don't know if a woman does get baldness, which they have done, and I've known women locally that have been prescribed it by certain private providers that have then presented with baldness. I can't say whether that's going to come back or be reversed because it's just not founded. The menopause specialist, so Mr. Nalpetta at Airedale, will prescribe it. He's got a bit more knowledge and he's obviously got a higher qualification, so he would be a bit more kind of in a position to prescribe it. So I think if you've got to that point where your GP is adequately estrogenised, you're on HRT, you're still struggling with libido and it's affecting your quality of life or your relationship, it needs to be spoke about. It's not a case of you just shut up about it. But I think that's something that a menopause specialist needs to decide, and then you'd need a referral to Airedale for that. Why do women gain weight in the menopause, and why is it more difficult to lose? And that is all because so when your estrogen levels drop and your body's screaming out for estrogen, that's what it needs, that's why you've got all these horrible symptoms. Actually, in subcutaneous fat, particularly around the fat around your middle, there is an enzyme that can convert inactive estrogen to active estrogen. So this gaining of weight, particularly around your abdomen in the middle age, in the menopause, is completely your body's normal physiological response in its attempt to try and improve and increase that kind of natural circulating estrogen level. So it is completely normal. Although women don't like it and they complain about it, it's definitely just one of those normal pathophysiology things that happens. And it's just an attempt to try and kind of regulate things. And as a result, then people say, well, why do I not lose weight when I start HRT? Because I'm replacing that hormone. And some people do, and some people don't, and that's not been founded. But I think some people do report slight kind of easier ability to lose weight once they're on the HRT and their hormone levels are a bit more normalised. But I think as long as you maintain, I know it's easy saying, like a healthy, balanced diet, that's what's key. There is some link, and I don't know whether some of you have read this, between dairy and the risks of breast cancer, but also dairy obviously contains a lot of hormones, the milk and things that we get from cows that are pumped through hormones to continually produce milk. So, and if you look at kind of cultures like Japan, they've got much lower rates of breast cancer. Women sail through the menopause in general. They're not plagued with the same symptoms. They have a lot less dairy. They have more soya milk, more phytoestrogens in the food that they eat. So it's probably worth, I don't think anybody will be able to well, here's the perfect menopause diet, but it might be worth just thinking about some of the things that you do have in your diet and seeing whether you can switch stuff up and see if you notice a change. The only other thing that
I've jotted down that I spoke about is CBT. So I suppose I should have said that in the alternatives. So again, I think it's something that as doctors, you're kind of scared to tell women in the menopause about CBT because they're kind of like, I don't need to go to counsellor or anything like that. I need to fix my hormonal problem. And that's completely understandable. But actually, a trained person in CBT to deliver correct menopause-related CBT, the outcomes in studies are incredible because they arm women with the tools to be able to change the mentality and the way in which they cope with hot flushes so that they are often much more tolerable throughout the day, particularly in public. You know, if you're in the supermarket queuing and you're kind of trying to pay for something at the same time, feel like you're about to ignite, and you know, all these things that massively plague women, CBT is thought to benefit them, and also improvement in terms of sleep, anxiety, mood, and clarity of mind. So I think it's something that's not to be kind of cast aside. I think it's as an arm to try if you don't want to try HRT, or to try as well. It has got great evidence behind it.
And don't forget, whichever surgery that you're registered at, every surgery should have a patient participation group so that you can voice your opinion and meet regularly. And it's always worth getting involved if you've got younger children and you want them to be part of it, because it is important to take control of your health. And practices do welcome that feedback. So rather than, you know, something horrible happening or something that you feel quite strongly about and then feeling like you do have to complain, kind of getting involved and getting on the board, you've got more say in the way in which your practice runs, and practices do really thrive on that. So if that's something that you are interested in, kind of brothers, sisters, dads, anyone, please, you know, we would welcome. We certainly at Skipton, we're all in Dyneley House, we're always looking for people to join the PPG.
Thank you very much.